Twice, Introduction to Pregnancy. Pregnancy is a remarkable journey that involves the growth and development of a baby inside a woman's womb. It typically lasts about 40 weeks and is divided into 3 trimesters, each with unique stages and milestones. Style stages of pregnancy. The first trimester, covering weeks 1-12, begins with conception, where the sperm fertilizes the egg, forming a zygote that implants itself in the uterine lining. Early symptoms during this period include nausea, fatigue, frequent urination, and breast tenderness. The baby's organs start forming, and by the end of the first trimester, the fetus is about 3 inches long. The second trimester, spanning weeks 13-26, is marked by increased energy, reduced nausea, and a noticeable baby bump. Some women may experience leg cramps and back pain. During this period, the fetus grows rapidly, and movements may be felt. The baby's heartbeat can be heard, and by the end of this trimester, it can respond to sounds. The third trimester, covering weeks 27-40, involves increased fatigue, back pain, and Braxton Hicks contractions. The baby moves into the head-down position in preparation for birth. The baby's organs mature and it gains weight rapidly, making it ready for birth by the end of this trimester. Prenatal, health and nutrition. Maintaining a balanced diet is essential for both the mother and the baby's health, including fruits, vegetables, whole grains, protein, and dairy. Prenatal vitamins are important for providing necessary nutrients such as folic acid, iron, and calcium. Staying hydrated by drinking plenty of water is crucial. It is also important to avoid harmful substances such as alcohol, tobacco, and certain medications. Prenatal care. Regular checkups are essential for monitoring the health of the mother and the baby, including ultrasound scans, blood tests, and glucose screening. Moderate exercise like walking or prenatal yoga can help manage weight, improve mood, and reduce pregnancy-related discomforts. Adequate rest and relaxation techniques, such as meditation, can help manage stress and prepare for childbirth. And common pregnancy issues. Morning sickness, characterized by nausea and vomiting, is common especially in the first trimester. Small, frequent meals and ginger can help alleviate symptoms. Gestational diabetes is a type of diabetes that develops during pregnancy and can be managed through diet, exercise, and medication if necessary. Preeclampsia is a serious condition characterized by high blood pressure and protein in the urine, requiring medical attention. Preparing for birth. Creating a birth plan is essential, outlining preferences for labor and delivery, including pain management, birthing positions, and who will be present. Packing a hospital bag with essentials like clothing, toiletries, baby clothes, and important documents is necessary. Childbirth education classes provide valuable information about labor, delivery, and newborn care. Postpartum care. Recovery after childbirth varies, and rest, nutrition, and support are crucial during this period. Breastfeeding offers numerous benefits for both mother and baby, and lactation consultants can provide support. Emotional health is important as postpartum depression is common, and seeking support from family, friends, and healthcare providers if needed is essential. Conclusion. Pregnancy is a unique and transformative experience. Proper care, nutrition, and support are vital for a healthy pregnancy and a positive birth experience. Each pregnancy is different, so always consult with healthcare professionals for personalized advice and support.